You're watching your local news leader. This is WCIA 3 News at 6:30.
Every time there was always something, so they can charge me.
Unexpected bills are piling up for that retired state worker. She says her insurance company agreed to cover essential treatments for her severe burn wounds. But the price tag on the bills from her doctor's office says otherwise. These bills are the latest fallout after Carl Foundation Hospital and its surrounding doctors cut ties with Aetna Medicare.
Target 3 investigative reporter Renee Cooper is back with us. Renee, your reporting last week revealed depleted doctor options for hundreds of patients.
That's right, and several more called me, including Evelyn Underwood, who retired after 20 years with the University of Illinois. She's required a lifetime of regular care for wounds left by childhood burns. The clinic at Carl Hospital in Urbana is the only place that can handle her care in town, and now that's no longer covered. So as the bills pile up, she's stopped seeing that doctor, and the consequences could be dire.
3 years old, and I had to learn how to walk again.
Evelyn Burnett Underwood was badly burned, and 76 years later, she's still suffering from swelling and severe pain in her leg.
All my life, I have to be careful, to not hit it or anything. And if so, it'll get worse, and then I'll have to have skin grafted. He called it calcinosis cutis because it's just like growing grass on concrete, because all the calcium.
She says it's not uncommon for the symptoms to get so bad that she has to see her wound therapy doctor at Carl Hospital every week.
They try to get some more of that calcium out.
It's the only place within an hour of Underwood that does this treatment she's come to rely on. And that was fine until Carl terminated a contract with her Aetna Medicare insurance plan January 1. Aetna first agreed to continue covering services with this doctor at the in-network rate through May.
It's critical. You can't have an open wound.
Then the bills arrived, totaling at least $13,000 for January, February, and March. Underwood appealed, and her insurer ultimately agreed to pay a fraction of the bills. Aetna told her the continued coverage doesn't extend to everything that was included in her appointments.
So we're gonna deny you. Well, I don't know what he's gonna do. I'm the patient. He does what he needs to do.
Underwood took care of her co-pays and asked Carl to put a hold on the bills, which she says they agreed to.
No, they're calling me at night. At 6:30 at night, my husband can tell you, saying that they're going to put it in collection.
But the most critical impact is that she stopped going to her doctor.
Because they say I could no longer see him. So I'm doing all I can to keep him from swelling. I have my special shoes, and I just stay off my feet. But they did say that because I said, I'm scared. If burst open, what I'm going to do.
And the next closest wound clinic for her is about an hour away, and that's if it's in network. And Underwood and her husband aren't able to drive. I asked Aetna if the company has plans to rerun her claims. No response there. I also asked Carl if they're still holding her bills and what other payment options might be available to help her continue that care. Those questions weren't answered, but Carl representative said they have been in contact with Aetna to offer support during this appeals process. And given Underwood's desperate need for a local specialist, I asked the Illinois Department of Central Management Services if this breakup between one of its administered plans and the largest health system in the area should count as a qualifying event for her and other patients so they can opt into another plan that actually serves their needs. Now, the state says patients were notified of the Carl and Aetna breakup prior to October open enrollment, but again, they were just left with one other more expensive option. More of that online. For now, I'll send it back to you.
All right, Renee, keep bringing it forward. Thank you.